Welcome to another new video, and today we'll discuss about the different hospital diets or the diets which are high in nutrients. What do you mean by high in nutrients? That means those diets which where we are actually improving the nutrient qualities, and we are making them in high amount. So generally, suppose an obese person will take a low fat diet, right? So that is low in a particular nutrient. So today we will learn about the different types of diets, especially the hospital diets, which are high in nutrient. Welcome to Educatus, myself Manjishta Chatterjee. Don't forget to like, share, and subscribe my channel and put the bell icon for more notifications. The first diet today that we will discuss is the high fiber diet. So, most of you have heard about high fiber diet. That when do we increase fiber in our diet, or why do we increase in our fiber in our diet? Basically, when our diet is full of fruits, vegetables, whole grains, legumes, we are increasing the high fiber, or we are increasing the fiber of the diet, and it is mainly able to prevent or relieve constipation. And also there are other health benefits like maintaining a healthy weight. So a person who is obese, they can also go for a high fiber diet. A person who has diabetes, heart disease, some types of cancer, they can always opt for a high fiber diet. When we were doing a low residue diet, we were talking about a low fiber diet, low residue diet, soft diet, a low fiber diet. And this is just the opposite diet when we are trying to increase the bulk of the roughage of the different parts of the food or the bulk of the diet, and these parts our body can't digest and absorb. Okay, so unlike the different components like fats, carbohydrates, proteins, which our body breaks and absorbs, fiber, it is not actually completely digested in our body, and it moves to our stomach, small intestine, and then they go out of your body. Then you will ask me, then what is the need of this fiber? Why do we have to take fiber in our diet? Fiber is always important because it improves the bulk of the diet, it increases the roughage, and that is also important. So here are some examples of fiber rich foods like broccoli, which also prevents cancer and also promotes hair growth, it is said, and protects eye. Squash, peas, red beans, mushrooms, oranges, cabbage, berries, different types of berries. These are high fiber in nature. So again, fiber is of two types. Okay, now one is the soluble fiber and another one is the insoluble fiber. So soluble fiber, from the name itself you can understand that these absorbs water, these are soluble, so these absorbs water and they form a gel sort of a thing which protects the gastrointestinal muscles and around the colon. And what it does, it slows down the digestion process and relieves constipation. It slows down the digestion process and relieves constipation. So these are the soluble fiber. And insoluble fiber, they stimulates the gastrointestinal tract, does the opposite. They stimulates the gastrointestinal tract, and they are helping in the healthy digestion. So insoluble fiber are always consumed in moderation, because too much of stimulation of the gastrointestinal tract is not necessary, right? So that is why soluble fiber you can take, and insoluble fiber in moderation you can also take. So from the picture itself, it is very easily understandable that which part or which fruits or which vegetables, which seeds are good in soluble fibers and which are in the insoluble fibers. To a high calorie diet, yes, where we are always talking about low calorie diet, low fat diet, why the need of high calorie diet? It is very much needed for people with diseases such as hyperthyroidism, but person who has a higher metabolic rate, or the person who has convalescence from fever, or it's super undernourished. Okay, so to those people this high calorie diet is very very much important. But definitely we will choose that kind of food in high calorie diet which are calorie dense, but it will not increase the weight. So it will not increase too much of weight gain, but it will be calorie dense, like granola, peanut butter, nuts, banana chips. These are all good for our health, as raisins, olive oil, dark chocolate, avocado. These are dense calorie, but these calorie are very good for our health. So what high calorie food can we take in a high calorie diet? That is avocado, ghee, which is very good, eggs, nuts and seeds, food fat, dairy can be taken. But we must not take sugary desserts, deep fried snacks. That means it will increase the calorie along with too much of cholesterol. Colas, processed meat, and beer, or any kind of alcohol in that case. So suppose we are preparing 1,000 calorie breakfast over here. So what we can take in a 1,000 calorie breakfast, for a 1,000 calorie breakfast only, what we can take a bowl of oatmeal, that is coming to about 270 kilocalorie, almonds, 1 ounce of almonds, 180 kilocalorie, 3 whole eggs, 214 kilocalorie, one medium avocado that you can take, 231 kilocalorie, and orange juice. So complete meal, if you are taking of this, it will give you 1,000 calorie. And suppose a whole day is 2,000 calorie diet you are taking, you can take oats with nuts in the morning, oatmeal with nuts, 400 kilocalorie, rice with seafoods like with fish, and anything with vegetables, fish, 500 kilocalorie, banana, it's a very calorie dense food, 100 calorie, any kind of protein shake, or you can make one shake for yourself, like with fruits, dense calorie dense fruit shake you can make, or you can buy one. Like steak and potato, like normal chicken steak you can have with potatoes, that will give around 600 calories, and calorie dense fruit like mango will give you around 300 calorie. So this will become a proper 2,000 kilocalorie meal that you can take for a whole day, those who want to gain weight. Lot people are thinking about losing weight, as well as there are people who think about gaining weight as well. So this can help you to gain weight in that case. So now the next one is a high carbohydrate diet. High carbohydrate diet is mainly given for people who has toxemia during the pregnancy time, liver disturbances, those who can't take too much of fat, proteins and all, and when there is a preparation for surgery. So what you can take, high carb vegetables you can take, like chickpea, sweet potatoes, corns, parsnip, like this is parsnip, green peas, pumpkin, squash, onions, potatoes. These are rich in carb that you can take. High carb fruits like mango, pear, dates, raisins, bananas, oranges, etc. Vegetables I just discussed. Beans and legumes are also rich in high carb. White breads, pasta, quinoa, these are also good sources of carb. Sugar, it is better to avoid, but if you have to take, you can take, it is permissible during this time, like honey, brown sugar, corn syrup that you can take, and sauces you can take during this time in case of a high carb food, like smoothie, coconut water, milk, cow's milk, iced tea, sweetened iced tea you can take. So happy people be taking too much of sweet, right? So those are in a high carb food. So people who on a low carb diet are to avoid this food, and people on a high carb diet can take this food. So these are a high carbohydrate diet. Coming to the Next variety is a high protein diet. High protein diet is generally seen or given to people who has deficiency in protein intake, or before and after pregnant sorry, before and after surgery it is given. High protein diet is very very much important. Injuries it is given because we know that protein help in injury healing, right? So injury burns, for that reason we have to give high protein diet. Along with that, in liver diseases, replace blood proteins in liver diseases, hyperthyroidism and anemia, pernicious anemia, we can give high protein diet. So these are all high biological value. Protein has to be given in high protein diet. Meat and fish, cheese, eggs, these are all good sources of protein as well as high biological value, especially the eggs. Along with that, beans, nuts and seeds, hummus and bread can also be given as a high protein food. So if I discuss about a whole day's high protein diet, then we can talk about egg white, cheese, yogurt and fruit in the morning breakfast. Then a salad with chicken and all vegetables you can give in the lunch. Dinner you can have a ground beef over here. It can be any kind of meat, cooked vegetables, low calorie pasta. Because when the carb is very high, we cannot give that much high protein. So when a protein rich meal has been given, so the carbohydrate has to be a little bit lower. So that we have to think about, right? So low calorie pasta has to be given, because we are trying to improve or increase the protein amount in the diet. And a protein ice cream is given over here, because ice cream or protein ice cream, protein infused ice cream, it can be given as a snack or a dessert. So that can be a high protein diet. So I hope you have understood that which nutrients can be given in high amount and what are the cases that we give these nutrients in a higher amount. And that's all for today. Next video will be coming the lower amounts of the different vitamins. So thank you. Stay tuned with Educators.